Look, I think it's important to be aware that people can be addicted to drugs, to alcohol, but also to behaviors. And these behaviors can include internet gaming, social media, gambling, sex, eating, and so on and so on. Now, the commonality between all of those behaviors and all of those substances is that when that substance is ingested or when that behavior is performed, there is a release of dopamine in the brain. And dopamine is the neurotransmitter of reward. It gets released very often with drugs in huge quantities, more than what would be released in a normal setting. And it essentially says to the brain, you feel good, this is a great thing, keep doing it. And over time, what starts as sort of recreational use, or using just for fun or for pleasure, becomes almost compulsive, where the person feels this need that they have to use for no other reason than I have to use. And very often through that compulsive use, other areas in that person's life are affected. They can be relationships with friends, loved ones, or families. It can be with your employer. And very often employment is the last area to be affected by substance use because it is a means to an end. Alternatively, there may also be medical complications, for example, hepatitis or lung infections or problems with the nasal cavity for people who use cocaine. So there may be sort of consequences to addictions that can be medical, they can be psychological, they can be social. And one could consider addiction to be the behavior that occurs when there are negative consequences to this drug or this behavior or the alcohol. But in spite of those negative consequences, the person still continues to use. And that for me is a good sign that that person might have a problem. When they have got problems that are identifiable to other people, and in spite of that, and in spite of awareness and acceptance of the fact that these are problems, these people will continue to use in a compulsive fashion. And essentially what this reflects from a neurobiological point of view is a hijacking of the brain's natural reward system. So your own natural ability to experience joy, happiness, and reward is replaced with an external or alternative source. And because these substances are so powerful and so strong, it makes it incredibly difficult for patients to stop that behavior by themselves without any help or without any intervention. And one of the big challenges for families is to get their relative to come and see someone who's got an interest in addictions. And what I say to my patients, and what I say to their relatives, and what I say to your audience as a whole, is that you need to find someone who will spend more time understanding the individual who is using, trying to understand the reasons why that person is using, and to try and more carefully evaluate that person's relationship with that substance. That's what I like to do in my clinical practice, and I think it differs quite a lot from other people who tend to take an approach of, you're using a drug, you mustn't do it, this is how we're going to help you stop. Sure, in my clinical consultations we get to that point and we get to those discussions, but I think one of the areas where we really have missed the boat when it comes to addictions is understanding a patient's relationship with that particular substance. Is it your friend? Is it your foe? Is it your loved one? Is it your companion? Is it the person that you go to when the world has hurt you? Is it the thing that you go to punish yourself because you feel like you're not worth anything? And these are very, very important parts of the discussion, of the conversation, because people use drugs for a reason. And sometimes understanding that reason is the first step of therapy. If it were as easy as a case of willpower, I wouldn't have a job. And we wouldn't have this problem with substances, because people would just be able to say, oh, I'm going to stop using and I'm going to be strong. And unfortunately, what we've forgotten to talk about with addictions is that addiction is a brain disease, of course, but that brain disease is a result of something, the substance use. And in the same way, analogous to that, the substance use is a reason or because of something else. And when we look at populations that have been most affected by substance use, we see very, very common threats in terms of unemployment, disenfranchisement, lack of opportunities, lack of representation at the governmental level, a tattered social fabric, absent fathers, gangsterism, and such. Whether you look at South Central Los Angeles, like the favelas in Rio, or Mitchell's Plain, these are common threats, which has led me to realize that addiction is a social disease. that has medical complications. And I think by focusing too much on the medical aspect of it, the brain aspect of it, by saying it's just a matter of willpower and just pull yourself together and these are the treatments that are going to change your chemistry, are actually not doing any justice to the social determinants for addictions. And willpower is an important aspect of treatment. People must be strong and they must feel confident in themselves. But if they are in a situation where that willpower or that self-confidence is completely decimated by the situation, the social setting that they find themselves in, how on earth is that person ever going to achieve success in terms of their substance-related goals?